Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Shaun Keating.
Hey everyone, Shaun here. Welcome to another episode of the Dental Up Podcast. Our guest this week graduated from the University of the Pacific Arthur A. Dugoni School of Dentistry and was named one of America's top 40 dentists under 40 in 2019. She's the proud owner and operator of the Orange and Magnolia Dental Studio and also the assistant clinical professor at USC's Herman Ostrow School of Dentistry. Currently practicing from Costa Mesa, California, please welcome Dr. Joyce Kahng DDS. How's it going, Dr. Kahng?
Great. Thanks for that crazy introduction.
Yeah.
Makes me sound very accomplished.
Nah, man, you're crushing it. You're so young and you're doing it all, man. So thanks so much. I know how busy. Heck, you just got in from USC. Heck, you're like a professor over there, aren't you, or something at USC? What are you doing over there at USC?
My position at USC is I work with all the students in the first and second years. Okay. So mostly the sim lab where I teach in karyology and fixed is my major course, and then even in the denture course. So this morning we did CAD/CAM, and we were just teaching them how to bond their restorations.
Oh, how cool is that? That is so neat. And that's awesome. My brother Kevin went to USC Dental School back. Heck, I think he graduated. You weren't even born. He graduated in 1981.
Oh, yeah, I wasn't born yet.
What year are you, like 84 or something, 87? Or?
I'm 86. Actually, my mom went to USC for dental school, and she was pregnant with me her last year.
Oh, you're kidding. What a small world. That's amazing. That is so cool. Heck, my boys are born. One was born in 84 and the other was born in 87. So it's like I'm talking to one of my kids. That's awesome. No.
Oh, yeah.
No, that's so cool. I like the way you got awarded that top 40 under 40. Tell me a little bit about that. What was that all about? I had another dentist in Texas that got that too. Tuan Pham. He's a really good dentist and great guy. But tell me a little bit about that real quick, if you could.
I don't know too much about it yet because they haven't really released the article. They just let us know that we were one of the winners. That's
so neat. Oh, that's awesome, man.
It's coming out in July. It was a big surprise. It was a nice surprise, though.
Oh, heck yeah. No, that's a huge thing for sure. And I love it. You're crushing it on socials and everything else. And that's why we wanted to get you on, man. So thank you so much. Hey, I always start off talking a little bit about sports. Are you into sports, or your husband or anything into football or baseball, or you big USC Trojan? Tell me a little bit about your sports and enthusiasm you have. If any.
I don't know very much about sports at all. My husband is really into football. He's really into golf and basically every sport, and we have very little in common.
Hey, that's how opposites attract, man. That's what it's all about. But that's awesome. Was he a USC guy too, or is he a Trojan fan, or?
No, he went to UC Irvine, but weirdly he's a UCLA football fan. Okay. And he's a Dolphins fan.
Oh, perfect. Miami Dolphins used to be my favorite team back in the day, when I was growing up playing football and youth football. Dolphins were like the best team in the NFL, so I always kind of liked them, and so that's kind of neat. And UC Irvine, our lab is right next to it here, and we actually got the football Rams coming there for about 7-8 days practicing preseason there, and it's kind of neat. Going to go over there and see some of the old legends and veterans of years past. I go see Jack Youngblood and all those guys, and I think that's Friday. I'm going to go over there and a couple weeks from now, and but that's pretty cool, man. UCI is a great school for sure. But USC, man, that's pretty awesome. We'll go ahead and dental up now, Dr. Kahng. So tell me why did you get into dentistry, and at what point did you think I want to be a dentist?
I was really young when I decided I wanted to be a dentist. I was in elementary school, and it's a little odd when you say that you want to be something and you don't completely understand what it is. And it's just because like your mom is a dentist and you grew up in a dental office. And even having grown up in a dental office, I didn't really truly understand what it meant to be a dentist. I just kind of wanted to be one because it was something I was familiar with, and my mom was a dentist. So I think that is one of the hard things, is never really know that you're going to like dentistry until, midway through school or after you graduate from school. You can just kind of imagine what it's like, and you can shadow as much as you want, but you'll never really know.
Exactly. That's a good answer there. And that's you started off young. I was kind of the same way, leap of faith. My brother was going to dental school at USC, and he's about, I think like 8-9 years older than me, but he was going to be a dentist, and he's like, Shaun, you could be a dental tech. And I'm like in 8th grade, he's making my mouth guards. And I'm like, sure. I didn't know what it entailed either, but I always knew it's going to be a dental tech. Then when I go to be a dental tech, it's like, man, this stuff's hard, and I'm not really that talented with my hands. So I was like, well, I got no choice. I got to do this, man. But no.
I guess you figured it out, huh?
Yeah, I guess. It's like I still remember, I tell this story that towards the end of the course, it was like a year course, trade school in Huntington Beach, and the dude, our instructor, was like, pulled me to the side and goes, Shaun, you know what, man? He goes, I just don't really know if this is for you. He goes, your hand skills aren't the best, and yeah, he was honest. He's being honest with me, because that was 1984, and it was like, dude, what do you mean? I go, he goes, well, maybe you should think about doing dentures, getting them removable. And I'm like, heck no, man. My brother's going to be a dentist. I'm going to be his lab tech. And he's like, well, okay, we're going to graduate you. And then I come find out a couple months later, my brother Kevin is like, well, he's just finishing up dental school, and he's in the Navy. They gave him a scholarship to USC and all that. And he goes, well, Shaun, guess what? I'm going to do a 2-year residency in Norfolk, Virginia. No, Bethesda, Maryland. And I'm going to do endo training for 2 years residency, and I'm going to be an endodontist. So I'm like, all right, that's cool. I have no idea. What's that mean to me? He's like, well, Shaun, that means to you is I'm not going to be doing crowns and bridges and all the stuff you're doing. I go, well, I could do your posts or something. He goes, Shaun, we just use gutter perch or fill it or whatever. And it's just like, oh, well, so I was on my own, man. Luckily, I went to a guy that was real sharp and, helped me learn the field, and, was a great mentor to me. But, gosh, it's a trip, man. A leap of faith. But
It is.
Remember that guy telling me
it
that.
Just so happens that he chose probably the one specialty that you're not needed.
Exactly. And he's like, yeah, you're on your own, Shaun. You'll be fine. And I'm just thinking, I remember I was kind of pissed at first, but then, I truly believe, nothing's by chance. Everything happens for a reason. So it is all meant to be. My life was all planned out. But it's just it's amazing how I look back, and it's just kind of neat when I hear you like at an elementary school level, knowing that, hey, I'm going to be a dentist, and my mom's a dentist, and that's kind of cool, man. So tell me when you got out of dental school. So tell me a little bit about your dental school. How'd you like it? Were you the top of the class? You really get into it perfectly? Was it easy for you? Tell me a little bit about your experience in dental school.
Oh, dental school was brutal for me. I did this 3+3 program. So actually, I knew in high school that I wanted to do this program. It's the 3+3 accelerated program. So you get your BS at the Stockton campus, and then you go to the San Francisco campus. That's the dental school. Okay. And so everything is really fast-paced. As you probably know, dental school at UOP is 3 years, which is very accelerated in itself. Okay. And oh man, I was a really good student when I first got into dental school. I was really on top of it, and part of that is because I was still 20 years old. I didn't really socialize. I didn't really go out. I just and while everyone else was out, I would just stay at home because I couldn't go anywhere. I was 20. Exactly. And midway through dental school, I turned 21, and then I started hanging out with my classmates and going out, and, my grades kind of dropped a little bit, but I think where I excelled was always in the sim lab or doing things with my hands. Didactically, like I started off really, really strong, but as the classes piled up, I just didn't have the time to absorb everything as quickly because my learning style it's like a really slow learning style where I listen to everything, I write out the notes, and it's not very efficient. While my classmates are really, really, I think very just fast and bright, they could absorb information really quickly. I felt like I was just falling behind and I would have to stay in the library a little bit extra long just to keep up with everyone. So didactically, near the end, once everything piled up, I was just trying to make it through. I was pushing through. But I did do pretty well when it came to the sim lab.
No kidding. Some people it comes to quicker, and it's almost like a blessing that, that it comes a little harder to the people. They have to work a little harder, and it works out. I mean, some of those guys are the top of their classes and stuff when they get into the actual field, and it doesn't end up that way. I've had so many guys get associates that are top of their class, and they come in and, they got a lot of theory and they got a lot in their head, and they're really good at taking tests and all that stuff. When it came to using your hands and having hand skills and people skills, which dentistry is a lot about, they weren't as great, and it's just something, it's kind of neat how it happened for you there. So that's pretty cool. So tell me a little bit about when you got out. You're quite young. Did you start off? Did you go work for mom? Did you go work as an associate? Tell me a little bit how you started off as an associate. Did you purchase practice? Tell me a little bit about that if you could.
Yeah, my mom had her own practice, and she actually sold it while I was in dental school. So I didn't go into her practice. People always ask me why, and just because she had a Korean-speaking practice and I don't speak Korean.
Okay.
So it wouldn't have been a very good fit, and we have very different personalities. I don't think we would have worked well together. And when I graduated dental school, I was 23 years old. So what I decided to do was do a GPR, a general practice residency, and I specifically wanted it in New York. I only applied to one residency, and that residency was Jacoby Medical Center. Basically, I just mapped out all the residencies from the Upper East Side to see if it's where I could live in the Upper East Side and just commute and then have a whole year living in New York. I didn't really feel like I needed a residency, but I just wanted to live in New York.
Yeah, no, that's cool.
So I did that.
Perfect.
I did that, and I learned, oh my gosh, I grew so much in that 1 year. Being so young as a dentist and having absolutely no life experiences. I mean, I'm so glad that I went out and I experienced life without parents hovering over me or, just that safety net that I was used to.
Yeah.
It was great being on my own. And then after that, I actually decided to stay in New York, which my parents weren't very happy about. And that was quite an experience because I didn't want to ask them for money. I didn't want to ask them for anything. So I started saving all my money in residency. And that I think I started saving a few months before residency ended so that I would be able to survive those couple months before I got my license, because I did licensure by reciprocity. And as soon as I got my license, I started looking for an associate job.
Okay.
And basically, I took anything that people would give me in the beginning because I was just so happy to work.
Oh, heck yeah. Especially, I think what you got, too, out of New York, it's such a tough city. It takes only the strong to survive, and to be able to work it and then also to be able to live in that kind of a city, you probably grew quite a bit, man. A lot more than Orange County, where it's all laid back surfer dudes and stuff around here. New York, man, it's only the fittest, strongest. And, walking down the street, man, you better watch yourself. There's sharp elbows, and it's just kind of it's a tough little town for sure.
It is. I grew so much, and I met so many different types of people. I think that's where I really started to develop my social skills. I was pretty quiet in dental school. I just hung out with the the same people all the time. But in New York is where I started to meet a variety of people, personalities, and figure out how I could speak to all different types of people.
Absolutely. No, it's a melting pot for sure. Unbelievable. That's a neat little story. So how long did you stay there? Tell me a little bit about the associateships. Was it more of the mill type? Was it private practices, managed practices? Tell me a little bit about that.
So a lot of my friends ended up getting their jobs Monday through Friday at one practice. What I ended up doing is associating at several different practices. So like maybe Monday, Tuesday, one place, Wednesday, Thursday, another place, and then Friday, another place. And I did that not thinking about it, but I really wanted to make sure that if I got fired from one job, I would still be able to survive. So that was my thought process. But in the end, I'm so appreciative I did that because I got a taste of so many different practices. And when I was, I guess, done with one practice, I learned enough from that practice or it wasn't the right fit, I would be able to say, no, I'm done here, and then move on to another practice without having to feel like I was so trapped and that I had to stay there for my livelihood. So I did that for a couple of years. I ended up practicing in New York for around 3 years.
Okay.
Maybe 2.5 before I moved to California. And just by having those experiences, I was able to figure out what I liked and what I didn't in a practice. I ended up settling down in one practice in Manhattan near Grand Central, and that was my major practice. And it was kind of a spa-like private office.
Okay.
But the twist was that it was an HMO practice, and I didn't really know too much of what went on outside in the front office. It was very well managed, and I was just doing dentistry.
Okay.
I'm assuming that with the HMO, now it's been center, I know that there's probably some like upselling and all that, but I was kind of separated from that. I just did the fast-paced environment in a very beautiful spa-like environment, and I was happy.
No kidding. But not knowing that the front office, man, that's a big part of dentistry for sure.
It totally is.
It's like it's the same thing with me, man. I was a waxer metal finisher for a few years, and I was a ceramist for about 3-4 years, and then I became the manager, of the department for like 14 years. But not knowing that when I started my own lab is like I know everything about teeth. I know everything about technicians and working with them and production, but that front office, man, that is just all the bells and whistles with the numbers, and had no idea. And I'm still learning it 17 years later. It's like, I'm not learning it. My people are. I just get the right people to do all that. It's important, front off, the dental school doesn't teach you that. They don't teach you a lot about the lab work as much as they should. And, they don't teach you how to run a business, be a business person. They teach you a lot of theory and a lot of stuff about anatomical mouths, and you're a lot more medical stuff that you don't really need. But it is what it is. But I wish they would, teach more on how to run a dental practice. For part of those 4 years or whatever. It should be part of the curriculum. And I know with you teaching over at USC, you're already getting into the digital part of it and the CAD and all that, and it's not old school anymore, man. It's no longer analog. It's it's a changing world, but no, that's really really kind of neat. So New York, you said, man, I'm coming to home now. Were you guys always Orange County or LA mostly where you lived, or coming back home? How'd you get into Orange County, and how'd you get into, say, Costa Mesa?
Well, I'm from Northern California, and I met my husband in New York. He's also a dentist, and he graduated from NYU School of Dentistry, and he just wanted to come straight back after graduating from residency.
Oh,
and I was like, no, I love my job. Like, I had no plans of leaving New York. I was well paid. I had a job I loved. I wasn't really, I guess, saving a lot, but I was just really enjoying the moment. And I feel like the fruits of my labor, like I was able to enjoy those while I was in New York. But he wanted to move back, and I was like, okay, we're not doing long distance. I just know myself. I'm not a long distance girl. So I packed up and moved back. Luckily, my parents moved to Orange County while I was in New York. So the decision was a little easier moving back for a guy. But as soon as I got back, I did put some pressure on him. I was like, "Where's my ring? Where's my ring?"
Exactly.
And I tried to associate in Southern California. I associated for a little bit, but in the back of my mind, I wanted to start looking for a office of my own. And I associated at this one place. They weren't paying me very well, but I was thinking, oh, I'm not going to work here that long. I'm just going to buy an office. And it took so long for me to find an office that I liked. All the offices that I saw were either really old, they weren't digitized yet. There was always something wrong with it. And I realized, oh my gosh, this is much harder than I thought it was going to be. So I ended up working there for a little bit longer than I had anticipated. And while working there, I realized I really don't want to work for anyone anymore, because I realized the dentistry that I was wanting to do was being limited by somebody else every time I worked for somebody else.
Exactly.
And I started to shift this focus. It became more of like a focus of what kind of dentistry do I want to put my name on? So then I found a practice finally, and I may have overpaid for it a little bit, but I'm very happy there. It was a small practice, and I took over like a small patient base that has been there for 45 years. It's an older practice. I just had to do a little bit of cosmetic rejuvenation, I would say, just to make it look a little better. But that base was a good start. And then from there, I just had to build my practice.
No kidding. How was it transitioning to you being such a young dentist compared to the old dentist and being older and everything else? Was it a male, female dentist that you bought from first off? Or?
It was a male.
Okay. God, I bet you that was a big, for all the existing patients, like, where's the new sheriff in town? How'd that go over?
Oh, yeah.
How was that? Was that okay transition? Or?
Yeah, the interesting thing is this practice I'm the fourth owner. The owner right before him was a long-time female practice owner. So she was there for about 15 years.
Okay.
The guy that I bought from, he was Asian. Okay. So by the time it got to me, the patients had already experienced somebody who was female and somebody who was Asian. So I was just a combination of all those things. But, what's hard about taking over a male practice is the amount of organization that he had. He didn't maintain any of the equipment. He really didn't have a lot of systems. The amount of organization that like a woman has. I can't speak for everyone because this is just the situation that I took over. But he didn't really have a good grasp on this organization thing of systems and having the assistant, take care of the autoclave and maintain all of the things in the office. And so as soon as I took over, everything started to break down.
Oh, man. It's all meant to be, though. I mean, I tell you, I've done this a long time. A lot of dentists are like that. You're not really, geez. But now, hey.
It's because people don't really know the business aspect. I think especially he didn't really understand the business aspect. When he took over the practice, it was very big. The practice owner before, the woman, she had done really well at that practice. And the practice kind of dwindled under his care, I think just because of the business know-how. And that's why I think it's really important to understand business concepts, even while considering a career in dentistry. So that's why I've gone to UCI a couple of times to speak to the pre-dental students, to talk to them about a little bit of the business aspect, because I think that if you decide you want to be a dentist, you actually have to think of it in terms of the whole picture, not just fixing teeth. It's the whole thing.
Absolutely. No, it totally is. And it's almost that with any business. You can make widgets and do all that and be the best of that. But if you can't run a business, and I tell you, I can't through all my years tell you so many dental practices that these guys women were just studs. And they just crushed it with the patients and had all the volume in the world, but they couldn't run the business for the life of them. And, just trying to do books themselves and just a lot of little things trying to cut the corners where, man, you got to get that down almost first, and you can almost be not kind of a halfway talented wise dentist, but with good business skills and be great and survive. But you can be an awesome dentist with bad business skills and you're going to not last a whole lot. And if you do last, it's just going to be up and down and like even two bouncing from labs when you can't pay your lab bill each month because you're not organized enough to have your bills in order and have enough cash flow. I mean, you just can't be doing that and bouncing from lab to lab and this and that. And I see it so many times with doctors. And even too, they're vendors, okay, I got to pay the, 3M because that's my impression material. Make sure they get their payment. And then it's just so crazy, like the basics, and they don't get it. And it's just, some of them live beyond their means, but this is any business in life. It happens to everyone, but it seems like dentists kind of, they either get it or they don't. And if they don't get it, they can survive. I see guys survive 10, 15, 20 years, on a shoestring, but it doesn't need to be that way. It's so easy if you can just get your structure in place and, take a couple, CE courses and practice management and just get your systems down. And it's just kind of like you're cutting your preps, using the same couple of burrs, and your impressions, you're using a double cord and you're using the same gum. I mean, you just get it down what it works and then just do it over and over and over. And it's like the Gladwell thing that he said way back, to master anything takes about 10,000 hours. And, you figure that's several years of 40-hour weeks, but you can master this. And especially if you put your mind into it and your heart into it. But it's just like I feel for some of these dentists, that they get all the CE and all this other stuff, but not the management part. It's like, dude, or bring people in at least to let them do it for you. And just, you won't make as much at the end of the day, but you'll sleep better. And it's just, people say they can't afford it. You can't afford not to. It's just the most important thing, I think, running a business. And I know this from my lab, and that's why I got people that can count and do all the number stuff. I'm not good at that. I'm not I'm not as smart as you, man. You're a smart one here. I'm looking at all this stuff. What about, I'm seeing on your, one of the things you like to focus on with your patients is relieving dental anxiety, focusing on patients that have dental-related anxiety. What are you doing to relieve anxiety for your patients? Tell me a little bit about that, if you could.
So one of the things that I've done, it seems very simple, but I just take my time with them and I listen to them and I let them know that I'm listening. So I think that's one of the biggest things.
Absolutely. And that's good for marriage also. You got to listen.
Yeah, it makes all the difference. And I think part of that is when we're running a practice, and this is also part of the business, is our time is money, and a lot of times we don't create enough time to sit down and fully listen to somebody. So if I know somebody has anxiety, I may schedule another appointment where I could just talk to them about their treatment. And the thing I think has made a really big difference in my practice is the fact that I've kept it very small and cozy on purpose. Okay. There are days when I have hygiene, and those days are a little bit more crazy. And I purposefully will schedule a patient with anxiety on the days I don't have hygiene. So basically it's just myself working in the office, and we're just going one at a time. So it's a very calm atmosphere. And it's hard to have that atmosphere in a dental practice setting because we are hiring all these providers. We want to get as many patients in and out as possible and increase our production. But there's something very nice about having an environment where everyone knows their job. Like, I don't even talk to the assistant. The assistant's just handing me things. Like, they know that we got this. And there aren't people walking in and out. I'm not distracted by doing a hygiene check and coming back. I think it also comes down to smells. Like, the office doesn't smell like a dental office. Mm-hmm. It's soothing. We have one thing that I do have that helps a lot of people is for their fear of needles, I have the STA or the wand anesthetic unit, and it's like the best thing I ever purchased.
Oh man, I'll attest to that.
It does not hurt.
Oh, it's amazing. I have Dr. Hornbrook. He used to be my clinical director here, and we do all these over-the-shoulder programs, work on all our technicians, and he introduced me to the one years ago, and he put it on me. We did some work. Unbelievable, man. That is just the neatest thing. You just kind of put it there, and it gives you a dose or something, or it's just that's just amazing, that one. And
you really don't feel it.
You don't feel a damn thing, and next thing you know, they're grinding on you, and it's just no shot. I mean, even too, I love the way a doctor can hide the shot and then sneak it up in there, but wiggle the lip and all that, and you're still gonna feel it, and it's just anxiety thinking about that long ass freaking needle, man. It scares the heck out of me. But that one, what a major breakthrough. I think every dentist should be doing that thing, man. That is so cool. It's just that is a game changer. I'm surprised more guys don't do it, but
it's expensive.
Yeah, maybe that's why. Because I find my dentists are pretty frugal.
And the overhead per procedure goes up because those syringes cost so much. But in the end, for me, I'm like, it's worth it. My practice has been syringe-less ever since I took over, and I think patients really, really, really appreciate that, whether they have fear or they don't.
Oh yeah, they do, and it's unheard of. I mean, God, I would market the heck out of that, and I think you're really pushing on the socials. Heck, I think you're Instagram. I mean, you're approaching like 20,000 people on Instagram, man. That's so cool.
Not yet.
No, it's pretty close. Let's get up
around
there.
15.
Well, 15 plus 16, that's you roll it over, man. You're almost at 20. I keep saying like I'm almost at 30. I've been at 27 or so for a while, but no, it's just especially all the people out there, and you just you got such a bright practice. We'll put some of your info on our show notes just to show it, and for you to be recognized too, one of America's top 40 dentists under 40, that's a real deal. I mean, that's a neat thing, and there's only a certain amount of people under 40 in the dental world, and you were picked for one of them, and that just goes to show you. And tell me a little bit, though, on your practice. How are you driving people to your practice? Is it mostly socials, like Facebook and Instagram and all that? Are you doing any mailers? What are you doing to drive patients to your practice?
Yeah, I do occasional mailers once a month, just to the neighborhood right around me, so it's a very small radius.
Okay.
I find that those work really well because my practice is it's not in a big complex. It's actually in a medical plaza in the middle of a neighborhood. It's very hard to find.
No,
the specs may not be that great, but I love that it's small and hidden. It's like a hidden gem. I do some Yelp occasionally. I have a love-hate with Yelp. I think it's horrible, but in many ways, I found that patients are finding us through Yelp. So I just ended up signing up, especially when I took on an associate. I decided I need to put my money where patients find us.
Absolutely.
And what else do I do? Otherwise, it's just word of mouth. The biggest thing that has been a game changer for my practice is my social media. And I don't spend any money doing ads for social media. I just post. I would say that it costs money to sometimes get good content. So for me, I have professional photography taken, and that's about the extent and also my time. But it's really driven a lot of patients to my practice. I would say if you were to include just the patients that come to me through Instagram, plus all the patients that they refer to me, it's around 70 to 75% of my new patient base comes through social media.
That's so awesome. No, that's, and most of my dentists, when we talk about it at the end of the day, they're not really into spending money on marketing. And there's some of them are trying to do the social media, but not like you are. But still 90% average, most of the practices are referrals from existing patients, and just they're your best customers. I mean, they're your best, platform for, your dental practices. take care of your patients, treat them well, do them good, and just let them know, get some kind of program where please let us know if you have any friends or anything you could refer. We'd really appreciate that. And it just goes so far. And same with me and my company. I spent all sorts of money on marketing, but the most I get is from my dentist, that if they give a referral of a peer, 1, 2, or 3 or whatever, they'll do it. And that dentist will actually take our call or maybe look at something from us saying, Dr. Kahng said, hey, Shaun Keating's got a great lab. Well, you should try, this. And it goes really far. So word of mouth with your existing people and patients.
Oh, yeah.
It's always going to be king, and it's free. All you got to do is just do the right thing. Exactly.
It's free. And, the social media, people don't realize that intertwines so well with your word of mouth. That plus your word of mouth is going to be the golden ticket free, because your social media is your business card. You don't need business cards anymore. That's your business card. Yep. My patients, let's say that I fabricated this 70% number, but a lot of them do find me through Instagram. And the way that I calculate it is they tell me, I found you through Instagram. And then later on, we'll find out it's actually through person. So it is word of mouth, but they found my Instagram because my patient told them, hey, you should go to my dentist. She's Joyce the dentist. And then they'll look me up, and then they will read through. And if they like me, I'm going to be floating at the top of their feed if I post every single day. It may not be that they're going to call me tomorrow, but when it comes time to switching dentists or finding a dentist, I'm going to be at the top of their mind.
Yep, it's so true. And my social media guy right here, Trey, is like nodding his head up and down. But it's weird. Even with us, we do a lot of mailers each month. We get 150,000 dentists to work with in the United States, and so we shoot out different state or several states each month. I mean, we send out quite a bit, but and 99% of it all gets thrown away. But anyways, we had it to where it's been happening recently quite a few times where a dentist said that they have heard, they have seen our letters in the past, but, they have a lab. They don't really need us or whatever, but they've had patients come in and said, have you ever heard of Keating Dental Arts? And it's like, I can't go and market to patients, to the public, because I can only work with, dentists. It's a legal thing or whatever, but it's something that, today, my sales dude coming goes, I wouldn't believe it. I got another doctor that called us and said we had mail them. They kept a letter from several months back, but just for was an offer. But they kept that letter, put it in the top of the drawer, and they've seen others since. But the doctor kept that one. But a patient was in the chair, this morning or whatever, and they said, "Have you ever heard of Keating? They do really good." I think could have been through Instagram or whatever it was, but they saw us, and so they're in there, and it's happened quite a few different times through the years that. So I always kind of say, oh, I can't market to the people, but it kind of does trickle down if you do enough things in the different areas. When it comes time, they might, say, hey, yeah, I would like to use this lab if you could do it. And sure enough, the doctor said, send us a doctor kit. I'll give you a shot, Shaun. So it's kind of cool. But, it's just, it's a lot of dentists, oh, it doesn't work and this and that. And I just think, I think there's a lot of things you do that it all works out. You can't just do one thing. I mean, you have different, platforms and, the Yelps and on with the different, Facebook groups and this and that. And they might see over here one time and over here, but I think it just all adds up. And just like with us going to conventions, we do print ads, we do it all. And it's kind of hard to say, we try to track everything, but, I think more so than not, obviously, is your word of mouth with your existing patients. But other than that, social media, just trying to find and crack it in a way. But heck, we can have patients telling doctors out there, I want to just market to the patients because there's millions of those guys. And then I could just have them bug the heck out of their dentist saying, send it over to Keating, man. They do all the Hollywood smiles. Come on now. But no. Okay.
Yeah, it's definitely an ecosystem when it comes to marketing. It's just not just one thing. You have to do a whole plan.
Oh, absolutely. Well, we'll try to wrap this up. I want to just ask you a couple more questions. So tell me how you got into be a professor over at USC. Tell me a little bit about that, and tell me what it, how many days a week, and tell me what it consists of, if you could.
Yeah, I actually became a professor kind of by accident. I had my practice and I had Thursdays off. So I was Monday through Wednesday and Friday at the practice, and Thursday I always had off. So I would volunteer as an adjunct faculty on Thursdays. Then I was there since 2014, and a few years later, they had a position open for assistant clinical professor, and I didn't really know about the position. It wasn't on my radar, and I think the day before the position was about to close, or like the application process was about to close, the clinical director, Dr. Eddie Shea, came up to me and he's like, "Hey, did you know that there's an opening? Like, I've never seen an opening here for the many years that I've worked here. You should totally apply." And I was like, "Dr. Shea, I have a job. I have a practice. I don't have time for this." And he's like, "Why don't you just apply and see? Because, like, who knows? You may not even get it, but you might as well just try." And I was like, "Oh, okay." So then I just applied, and it's not like an easy thing. You have to get letters of recommendation. He's like, "I'll write you a letter of recommendation." Mm-hmm. And I applied. I didn't know what was going to happen. I didn't really even particularly care what happened, because I just was going to work every single day. And they called me for an interview. And I was like, okay. So I went to the interview. I thought it was going to be a very easy interview because I've been working there. They know who I am. Mm-hmm. But I walked in there. They asked me some really hard questions. These people, I knew them, but they were so serious. And I was like, oh my gosh, this is a very serious thing. Like this, let's take this very seriously. So I finished up all of the interviews. It was not just one, it was a couple interviews. Okay. And then I went home and I was telling my husband, I was like, I don't think I did very well on those interviews. Like, it's been a long time since I interviewed for a job. And they told me it was a while. It was like a month later they made a decision. Somebody else had already been chosen, but I knew there was 2 positions. And they told me that I was chosen for the other one, and I went into like this freak out panic mode. I don't want it. I was excited because I had interviewed for it, and I did kind of want to see where it went, but I was freaking out because now I had this like crazy decision to make. And I was telling my husband, I was like, what do I do? I have a practice. And my husband was like, do what you want to do. He's like, do you want to see where this takes you? Do you want to see if you like teaching? Because the problem is you don't know whether you're going to like teaching. It's totally different. Yeah. And I had a small taste of it, but for it to be really a 50% or 60% position, which is half the week, that's a huge commitment. So I had to make I had to organize my practice a different way because I wouldn't be there as much, but I had to hire an associate. There's a lot of things to do in order to work at USC. Absolutely. And I decided in the end that I want to see what it would be like to work at a school and be a professor, because it's nothing I had ever imagined myself being. And I wanted to just see if I liked it. And then if I liked it, then I would continue a year. That's what I told my husband. If I liked it, then I would continue a year. And now it's been a couple of years and I'm still there. My practice, I had to make many changes to the practice in order for me to be there so many days. I hired that associate. I hired more days of hygiene so that things could run a little bit more without me. And then the days that I'm at the practice, it's scheduled. So I'm like, bam, 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 bam. Except for those few days when I'm without hygiene. And those are for the days when people who are having anxiety or fear come in. No. So it's been major changes. It was scary at first to take a small practice and have to have new providers there because there was some resistance with the patients. Mm-hmm. And also it's a lot more overhead than just me working. Absolutely. And the practice has caught up and is doing quite well with everyone new. It's actually been quite a blessing to the practice to be forced to grow so fast and to rise to the occasion.
That is so cool, man. I just think it's the best thing you did too. And to get that under your belt at such a young age, that'll come back in spades. I mean, it truly will. And heck, that maybe did something on the top 40 dentists under 40. You never know. Being a clinical adjunct professor, whatever it's called, I don't even know how to say it, but it's pretty awesome, man. Well, dang, what kind of advice can you give some of the newer dentists starting out and some of the do's and don'ts? What would you say to some of the newer students coming out of dental school?
Oh, that's a good question. That's actually a really hard question, because everyone comes out of school with different abilities and different strengths. I would say know your worth is one of the most important things. And I say that because it's not just to empower the new dentist, like, hey, go get that job and fight for what you want. It's not just that.
Yeah.
It's also it's a little bit of real talk. It's a little bit of reflection on where you are in your career. So in the beginning, I wasn't picky. I went out, I saw what was out there, and I learned. I think come out of school thinking, I'm a doctor now, I'm a dentist now. Like, these are my standards. But your worth in a situation where you are associating is different than your worth in a situation where you're practicing. If you're associating, your worth is based on how much you can produce for that owner. Your worth as a dentist who works for yourself, as your practice owner, is possibly different. For me, it's the quality of my dentistry. So all these things change. You define your success and be realistic about where you are and always keep growing.
Oh, it's awesome. That is great thought out advice right there, man. Well, heck, Dr. Kahng, I know this was supposed to be short and sweet, but man, you're just very interesting, and that's such a neat story.
Oh,
and
thank you.
I look forward to seeing you in the future all over the Dentistry Today and ADA News and everything else. I'll say, hey, I had her on a podcast.
Oh my gosh.
Well, thanks so much, and God bless you and your family,
yeah,
man.
This was fun.
No,
Thank you.
Anything we could ever do for you? You got a big roundhouse or something you're not sure? Send it over to us. We're right up the street. Hey, well, thank you so much, and we really appreciate it coming on the Dental Up podcast. And again, if we can ever do anything for you, Dr. Kahng, let us know. And
thank you. It was really fun being on here today and talking with you too.
All right, man. Well, good one, and we'll talk real soon.
Okay.
Take
care.
Okay.
Bye.
Bye-bye.
Thanks for joining us on the Dental Up podcast show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.